Let's explore, learn and create together. A warm good morning to one and all. Welcome you all to today's state level workshop, Oncology Unplugged, Collaborate, Educate and Cure. It represents a modern inclusive vision of cancer care that focuses on unity, knowledge and compassion. Underscores the power of collaboration among the healthcare professionals, researchers, patients and communities to advance understanding and treatment of cancer. Through continuous education and shared expertise, this approach aims to strengthen prevention, enhance early detection, and improve treatment outcomes. Ultimately, it reflects a collective commitment to not only curing cancer, but also to supporting patients holistically, and to live with dignity, hope, and quality of life. On this auspicious gathering, we have with us the chief guest, Dr. Smita Carol Saldana, MBBS MDS, Kidwai Memorial Institute of Oncology, Bangalore. Dr. Haji UK Monu, the Honorable Chairman, Kanachur Islamic Education Trust. Dr. Muhammad Ismail Hejamadi, Chairman, Kanachur Health Sciences Advisory Council. Dr. M. Venkataraya Prabhu, Member, Kanachur Health Sciences Advisory Council. Professor Dr. Molly Saldana, Principal, Kanachur College of Nursing Sciences. Dr. Shanwas Manipadi, Dean, Kanachur Institute of Medical Sciences. Dr. Anjan Kumar, Medical Superintendent, Kanachur Hospital and Research Center. Dr. Rohan Moniz, Chief Medical Administrative Officer, Kanachur Hospital and Research Center. And today's resource person, Dr. Guru Prasad Bhatt, Associate Professor, Chief Medical Oncologist, Kanachur Hospital and Research Center. Mrs. Irene Saldana, Nursing Superintendent, Kanachur Hospital and Research Center. Prayer is not for someone to listen, but it is to strengthen your faith in God. Here we have Mr. Siyad and Mr. Nimma bestow us with the God's blessings with the Holy Quran recitation.
Assalamu alaikum. أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم الحمد لله رب العالمين الرحمن الرحيم مالك يوم الدين إياك نعبد وإياك نستعين اهدنا الصراط المستقيم صراط الذين أنعمت عليهم غير المغضوب عليهم ولا الضالين آمين صدق الله العظيم.
In the name of Allah, the gracious, the merciful. Praise to be Allah, Lord of the worlds, the most gracious, the most merciful, Master of the day of judgment. It is you we worship and upon you we call for help. Guide us to the straight path, the path of those you have blessed, not of those against whom there is anger, nor of those who are misguided.
Raised in unity, as this anthem echoes the pride, culture and spirit of our beloved state with pride and respect. I invite Miss Juvita and team lead us in the state anthem. Let us raise for this state anthem.
जय भारत जननीय तनु जाते जय हे कर्नाटक माते जय सुंदर नदी वनಗಳ ನಾಡೆ जय हे रस ಋಷಿಗಳ ಬೀಡೆ ಭೂದೇವಿಯ ಮಕುಟದ ನವಮಣಿಯೇ ಗಂಧದ ಚಂದದ ಹೊನ್ನಿನ ಗಣಿಯೇ ರಾಘವ ಮಧುಸೂದನರ ಅವತರಿಸಿದ ಭಾರತ ಜನನಿಯ ತನುಜಾತೆ ನಾದದ ಘೋಷ ಜನನಿಗೆ ಜೀವವು ನಿನ್ನಾವೇಶ ಹಸುರಿನ ಗಿರಿಗಳ ಸಾಲೆ ನಿನ್ನಯ ಕೊರಳಿನ ಮಾಲೆ ಕಪಿಲ ಪತಂಜಲ ಗೌತಮ ಜನರುತ ಭಾರತ ಜನನಿಯ ತನುಜಾತೆ ಜಯ ಹೇ ಕರ್ನಾಟಕ ಮಾತೆ ಶಂಕರರ ಮನುಜ ವಿದ್ಯಾರಣ್ಯ ಬಸವೇಶ್ವರ ಮಧ್ವರ ದಿವ್ಯಾರಣ್ಯ ರನ್ನ ಷಡಕ್ಷರಿ ಪೊನ್ನ ಪಂಪಲ ಕುಮಿಪತಿ ಚನ್ನ ಕುಮಾರ ವ್ಯಾಸರ ಮಂಗಳ ನಾಮ ಕವಿ ಕೋಗಿಲೆಗಳ ಪುಣ್ಯ ರಾಮ ನಾನಕ ರಾಮಾನಂದ ಕಬೀರರ ಭಾರತ ಜನನಿಯ ತನುಜಾತೆ ಜಯ ಹೇ ಕರ್ನಾಟಕ ಮಾತೆ ತೈಲಪ ಹೊಯ್ಸಳರಾಡಿದ ನಾಡೆ ಡಂಕನ ಜಕನರ ನೆಚ್ಚಿನ ಬೀಡೆ ಕೃಷ್ಣ ಶರಾವತಿ ತುಂಗ ಕಾವೇರಿಯವರ ರಂಗ ಚೈತನ್ಯ ಪರಮಹಂಸ ವಿವೇಕರ ಭಾರತ ಜನನಿಯ ತನುಜಾತೆ ಜಯ ಹೇ ಕರ್ನಾಟಕ ಮಾತೆ ಸರ್ವ ಜನಾಂಗದ ಶಾಂತಿಯ ತೋಟ ರಸಿಕರ ಕಂಗಳ ಸೇಯುವ ನೋಟ ಹಿಂದೂ ಕ್ರೈಸ್ತ ಮುಸಲ್ಮಾನ ಪಾರಸಿಕ ಜೈನರು ಧ್ಯಾನ ಜನಗಣ ಹೋಲುವ ದೊರೆಗಳ ಧಾಮ ಗಾಯಕ ವೈರಿಕರ ರಾಮ ಕನ್ನಡ ನುಡಿ ಕುಣಿದಾಡುವ ಗೇಹ ಕನ್ನಡ ತಾಯಿಯ ಮಕ್ಕಳ ದೇಹ ಭಾರತ ಜನನಿಯ ತನುಜಾತೆ ಜಯ ಹೇ ಕರ್ನಾಟಕ ಮಾತೆ ಜಯ ಹೇ ಕರ್ನಾಟಕ ಮಾತೆ ಜಯ ಹೇ ಕರ್ನಾಟಕ ಮಾತೆ
For setting the tone of respect and unity through the state anthem. Universal welcome. It can make the day a good day easily. Let's come to give a red carpet welcome to everyone assembled here. May I take pleasure of request Professor Dr. Molly Saldana, Principal, Kanachur College of Nursing Sciences.
A very good morning to one and all. Today is a moment of immense pride as Kanachur College of Nursing Sciences hosts the state-level workshop on Oncology Unplugged, Collaborate, Educate and Cure. After cardiovascular diseases, cancer remains the second leading cause of death in India. The most common cancers are oral and lung in men and breast and cervical in women. It's therefore crucial for healthcare professionals to stay updated with the latest advancements in treatment and patient management. This workshop provides a multidisciplinary platform for learning the practical aspects of oncology care. Emphasis is placed on hands-on training, evidence-based practice, and real-world clinical scenarios, enabling participants to enhance their competence and confidence in delivering safe and effective cancer care. Hosted in the state-of-art facilities at Kanachur College of Nursing Sciences and guided by experienced faculty, this workshop underscores the importance of continuous professional development in oncology, equipping healthcare providers to improve treatment outcomes and contribute meaningfully to fight against cancer. It gives immense joy to extend a warm and heartfelt welcome to all our distinguished guests who have joined us on this special occasion. We are deeply honored to welcome Dr. Haji Ukyemono sir, the esteemed chairman of Kanachur Islamic Education Trust. The phenomenal growth of Kanachur campus to his unwavering mission, ambition and hard work. His relentless efforts have propelled institutions to great heights, particularly in the field of healthcare. We are truly proud of our chairman, sir, for his remarkable contributions to education and healthcare. A very warm welcome to you, sir. I request Professor Sherin to offer a floral welcome. It's indeed a privilege to welcome our chief guest, Dr. Smita Saldana, Senior Consultant and Medical Oncologist, Kidwai Memorial Institute of Oncology, Bengaluru. Whenever the art of medicine is loved, there is also a love of humanity. A gem in the medical fraternity, Dr. Smita's vast expertise in medical oncology and her numerous prestigious awards throughout her career stand as a testament to her dedication and service. She has devoted her life to making a meaningful impact through her work and compassion. We are deeply thankful to Dr. Smita for gracing this occasion. It's an honor for all of us to listen to such an inspiring medical professional. A hearty welcome to you, dear madam. I now request Honorable Chairman to welcome Dr. Smita Carol Saldana with a token of appreciation by offering a plant. With equal pleasure, we extend a warm welcome to Mr. Abdul Rahman Sir, Director, Kanachur Institute of Medical Sciences, in his absence. Known for his meticulous planning and kind nature, he continues to be the guiding force for both students and staff. A cordial welcome to you, sir, in your absence. We are privileged to have Dr. Ismail Hajamadi, Chairman, Kanachur Health Sciences Advisory Council. We are grateful for your presence, sir, and extend a heartfelt welcome to you, sir. We are also honored to welcome Dr. Venkat Rai, respected member of the Kanachur Health Sciences Advisory Council. A warm welcome to you, sir. It gives me great pleasure to introduce Dr. Guru Prasad Bhatt, Associate Professor and Chief Medical Oncologist, Kanachur Hospital and Research Center, and the resource person for today's first session, Frontiers in Oncology. An Iron Man and an avid nature lover. He has written articles on butterflies, completed more than a dozen ultramarathons, and scaled 3 of the highest peaks in Africa, Europe, and Australia. A passionate swimmer, he has braved encounters with marine life, including sea lions, dolphins, and underwater kelp forests. Alongside his commendable professional achievements, these remarkable pursuits reflect his extraordinary spirit and dedication. A cordial welcome to you, sir. I now request Dr. Rohan Monis to offer a plant and welcome Dr. Guru Prasad Bhatt. A sincere welcome is also extended to Dr. Anchan, Medical Superintendent, Kanachur Hospital and Research Center. Welcome you, sir. A warm to Dr. Rohan Monis, Chief Administrator and Medical Officer, Kanachur Hospital and Research Center. Welcome you, sir. Delighted with the presence of Dr. Vidya Prabha, the Principal, Kanachur Ayurveda Hospital and Medical College, and Dr. Suresh Nagalaguli is here, Director, Kanachur Ayurveda Medical College. So we welcome you, sir, to this program. Welcome you, madam. We welcome to Ms. Irene Saldana, the Nursing Superintendent of Kanachur Hospital and Research Center. Also, we have our Deputy Nursing Superintendent, Madam Joshi. We welcome you to this program. A cheerful and Barnes, organizing Joint Secretary Mrs. Divya, along with all the teaching and non-teaching staff whose hard work and dedication have made today's event possible. Welcome you all. A special welcome to the heads of department and the faculty members of the Kanachur group of institutions. We are pleased to welcome the media personnel. We are here to cover this memorable event. Thank you for your presence and helping us to share this special occasion with the wider community. We are proud to have around 168 delegates over here, including our hospital staff nurses. So we cordially welcome all of you to this workshop. Welcome you all. Once again, a grand and warm welcome to one and all. Thank you. Have a pleasant day.
Thank you, ma'am. I heartily welcome you too, ma'am. Where we plant a seed, we plant a hope. As we water this plant, we symbolize the nurturing of knowledge. May this workshop grow and flourish with the same dedication, patience and care. Now I request all the dignitaries on the dais to inaugurate this auspicious day by watering the plant. I request everyone to kindly rise for this inaugurational ceremony. Needs to dispense overview in order to notify its significance. Therefore, I request Mrs. Anne Barnes, Professor, Kanachur College of Nursing Sciences, to provide the overview on Oncology Unplugged, Collaborate, Educate and Cure.
An investment in knowledge always pays the best interest. Honorable dignitaries seated on and off the dais, esteemed guests and dear delegates, a very warm and cheerful good morning to each one of you. Cancer is a global health challenge that requires a multifaceted approach combining scientific innovation, clinical expertise and compassionate care. When cancer continues to claim nearly 10 million lives globally each year, staying abreast of the latest advancements in treatment and patient management is not just important, it's imperative. This rising incidence of cancer across populations underscores the urgent need for continuous education and collaboration among the healthcare providers. In an era where cancer incidence continues to rise and treatment modalities become increasingly sophisticated, healthcare professionals require regular updates on emerging technologies, evidence-based practices, and patient-centered approaches. Kanachur College of Nursing Sciences proudly hosts the state-level workshop titled Oncology Unplugged, Collaborate, Educate and Care, which is envisioned as a comprehensive platform to facilitate this essential exchange of knowledge and skills. By 2050, global cancer cases are projected to rise by over 77%, with India expected to see a significant increase in both incidence and mortality due to the demographic shifts as well as the lifestyle changes. The complexity of cancer treatment has increased exponentially with the advent of precision medicine, immunotherapy, and targeted therapies, creating a knowledge gap that must be bridged through continuous professional education. The significance of this workshop extends beyond mere knowledge transfer. It represents a strategic initiative to gain insights into the latest advancements, technologies and approaches transforming oncology care, understand protocol, safety measures and best practices for handling and delivering chemotherapy effectively, as well as develop practical skills in managing central venous access devices to ensure patient safety and comfort. The theme, Oncology Unplugged, Collaborate, Educate and Care, signifies our commitment to moving beyond conventional approaches, disconnecting from routine practices to reconnect with innovative thinking. We have got there three main components, that is collaborate, educate and care. Collaborate, that is encouraging seamless teamwork among multidisciplinary oncology professionals to improve patient outcomes. Educate, that is providing up-to-date knowledge and practical skills necessary for providing the modern cancer care delivery. Care, that is promoting a holistic patient-centered approach that addresses physical, emotional and psychological well-being of cancer patients. As we step into today's session, we are confident that each delegate will gain valuable insights as well as fresh perspectives. The lineup of speakers and activities promises to spark meaningful discussions and practical takeaways. I express my sincere gratitude to all the distinguished speakers, dedicated participants and organizing members for their commitment to this cause. We encourage everyone to participate actively and make the most of this opportunity to learn and connect. Let this workshop be a platform for growth, collaboration and inspiration. We are excited for the enriching journey ahead, wishing you all a truly rewarding and knowledge-filled experience. Thank you.
Thank you, ma'am. Fortunate to have with us an eminent personality as our chief guest, Dr. Smita Carol Sultana, Associate Professor, Department of Medical Oncology and BMT Unit at Kidwai Memorial Institute of Oncology, Bangalore. Dr. Sultana holds an MBBS from KS Hegde Medical Academy, Mangalore, and MD in Internal Medicine from Father Muller Medical College and Hospital, Mangalore. Doctorate in Medicine, Medical Oncology from Kidwai Memorial Institute of Oncology, Bangalore. She further specialized with a fellowship in bone marrow transplantation from Narayana Health, Muzumdar Shaw Medical Center, Bangalore, and is an European Society for Medical Oncology extracorporeal membrane oxygenation certified expert. Throughout her career, Dr. Sultana has received several prestigious awards, including the Nitti Education Trust Award for highest marks in community medicine and ENT, and the Best Poster Award at INSPOCON, Indian Society of Medical and Pediatric Oncology at Mumbai. She has also received the FIPSA grant for research hypothesis presentation and has participated in prestigious preceptorship programs, including the RCC preceptorship program at Taiwan and European Society for Medical Oncology preceptorship on metastatic bladder and kidney cancer, non-small cell lung cancer and immuno-oncology. Dr. Sultana has an impressive publication record with over 91 papers in medical oncology. She has presented her research at various international conferences, including the European Society for Medical Oncology Congress, International Association for Study of Congress, European Association for Cancer Research Congress, and American Society of Clinical Oncology annual meeting. With her vast expertise in medical oncology and bone marrow transplantation, Dr. Saldana has successfully performed numerous transplants and is leading the BMT unit at Kidwai Memorial Institute of Oncology, Bangalore. We are honored to have Dr. Smita Saldana, ma'am, share her insights and expertise with us today.
Good morning all. So, respected dignitaries on the dais, Dr. Aji UK Monu, Chairman Kanachur Islamic Education Trust, Dr. Ismail Ejamadi, Chairman Kanachur Health Sciences Advisory Council, Dr. Hemvi Prabhu, Member Kanachur Health Sciences Advisory Council, Dr. Rohan Monis, Chief Administrative Medical Officer, Kanachur Hospital and Research Center, Dr. Anchan, MS, Kanachur Hospital and Research Center, Dr. Guru Prasad Bhatt, and Professor Dr. Molly Saldana. So good morning to all of you here. Firstly, I would like to thank all the organizers and faculty of this conference and dear delegates, students for having me here today. So it's my hometown. I'm very happy to be back in Bangalore. It gives me great pleasure and privilege to stand before you today at this continuing nursing education program on cancer. I think cancer is the word which makes a big difference to each individual. And you are the people who would make a huge difference in each member of cancer patient and that caregiver family. So I would like to begin this talk with a story. Early during my career, over 2 decades ago, I had a simple experience where I watched a nurse at a rural health center. She was carefully examining a rural patient's mouth. She spotted a small white patch in that patient's mouth, a bit that a postgraduate student of mine had missed. And he dismissed, saying that it is nothing. Now this particular nurse, she persisted, and the patch was biopsied, and it turned out to be an early oral cancer. For that man, it was a life-changing moment. Thanks to that timely action, today that patient is alive and watching his grandchildren grow. So it tells you the importance of noticing or detecting early any symptom. That nurse's knowledge, a vigilance, and a courage to act, these are the qualities I see in this room today. Today, we face harsh truths in India regarding cancer. The number is growing. It's over 1.4 million new cancer cases each year. And by 2030, this may approach almost 2 million. That's a tremendous and a huge number. Cancer in rural areas is often diagnosed late. Awareness is low. Screening is minimal. And many patients travel hundreds of kilometers for treatment, arriving too late. What is worse is the aspect of treatment abandonment. That silent tragedy which unfolds is very real. Roughly 20 to 30, I can almost say 40% of our patients stop midway. Not because the treatment is failing. It may be because of the side effects. It may be it overwhelmed them. The costs were very huge. The hope dwindled. This is where you all will make a difference in these patients' lives. There are too few oncologists and even fewer specialized oncology nurses. Therefore, you become the front line, each of you, whether in primary health care, wards, hospitals, or community. What can you do? You are early detection specialist. When you run a self-breast examination camp, you screen a tobacco user for oral lesions or perform the early screening methods, that is visual inspection for cervical cancer. You are practicing preventive oncology. You are treatment navigators. Cancer care is very confusing. Only that particular patient and the family undergoes that trouble. Multiple tests, multiple visits to hospital. You help these patients and their families find the way. That is why you are called the navigator. You explain, remind, connect and support. You are symptom management experts. Nausea, pain, mucositis, neuropathy. So Dr. Guru was saying, the first thing when we say chemotherapy, the first thing what comes to a patient's mind or the patient party is hair loss. So even at present, when I counsel a patient specifically for breast cancer, a lady, the first thing they're worried about is their appearance. Each of this will haunt the cancer patient. Your skill in managing these determines whether the patient continues the treatment or gives up. You are educators and advocates, teaching a breast self-examination, explaining about the chemotherapy need, advocating for pain relief. These actions save lives and uphold the dignity. You are compassionate companions. The hand you hold, the tear you wipe, the extra minutes you give, they are invisible labor, but they count deeply. What is it in this continuing nursing education program? What will it equip you to do? So today's program is designed to strengthen your capabilities across the continuum of cancer care. In assessment skills, helps you recognizing early signs of common cancers in India. If you know the urban population, in Bangalore we say it's the most leading cancer is breast cancer. 1 in every 10 women can develop breast cancer. And with our lifestyle changes, the lifestyle modifications, what we have undergone, the incidence of breast cancer is rising tremendously. I see a lot of young women over here, and even the men who are here, you will have somebody in your family. So it's very important that we detect this breast cancer very early. So there your role comes in. Helping in screening techniques, the hands-on practicals in the clinical breast examination, oral cavity examination. Chemotherapy competencies. As a prescriber, I prescribe the medicine. The handling, the administration lies in your hands. So the safe handling of cytotoxic drugs, managing infusion reactions, preventing extravasation injuries. Psychosocial support, conducting difficult conversations, managing patient and family anxiety, offering culturally and sensitive care. Palliative care. This is a very important aspect in the Indian population or in our present setup. We don't give much importance to palliative care. So palliative care provides comfort beyond cure, supporting those with advanced disease and their families with dignity and compassion. Patient and family education, empowering patients, engaging families in care, improving adherence through teaching. Therefore, my message to all you participants, to the nursing students here, for you, the students, oncology may seem very daunting. It deals with serious disease, complex treatments, sometimes death. But let me tell you, what it also offers is intellectual challenge, professional growth, meaningful relationships, the satisfaction of life-saving work. You will never stop learning. You will specially use your nursing skills in a scarce field with a high need. You will know the patients deeply, their hopes, fears, families, and their stories. You will make a difference in each patient's lives. As you listen to today's sessions, watch not only what is taught, but how the experienced oncology nurses, experienced oncologists think, communicate, decide, and care. Those are skills you can't learn in a textbook. To all the working nurses here, to those of you already working in cancer care, your wisdom is invaluable. You have handled complication, soothed the suffering, guided families. Your presence here shows you continuing commitment to excellence. Please share your stories during the sessions, share your real world information, mentor your colleagues, to the students and the younger nurses. Your experience is teaching for these young nurses here. Therefore, today is just the starting point. This program is only as valuable as what you do afterwards. Apply what you learned today as soon as you return to work. Don't wait for the perfect moment. There is never a perfect moment for learning. Share freely with colleagues who could not attend today's session. Keep learning. Join nursing societies, read oncology nursing journals, attend further programs. Reflect on your practice. What went well? What might you do differently? What do you need to learn more about? And support each other. Form peer groups, debrief after the tough cases, share resources. I hope the following is furthered through this program. Our administrators and policymakers continue to encourage and support continued nursing education. Nurses need protected time for learning, financial assistance to attend the programs, recognition for their improved skills, opportunities to apply what they learn, and structured mentorship. Investing in nursing education is one of the highest return investments in healthcare. Well-trained nurses mean better outcomes, fewer complications, greater patient satisfaction. And I can proudly tell you that in Kidwai, I was the leading person for starting that bone marrow transplant unit. I have a very dedicated and excellent nursing support team, because of which it makes a big difference in our bone marrow transplant unit. We have completed more than 130 or 140 transplants at it's a government organization, totally, completely, almost free, I can say, with only 1% mortality. That's an excellent number for a government organization, and that is possible only because of my nursing team. As I end, let me share my hope for all the participants here. I hope this program instills confidence to trust your judgment, to speak up for patients. Inspiration to pursue excellence, to view oncology nursing as a field worthy of your best efforts. Connection with colleagues who share your commitments and challenges. Renewal on days when nursing feels overwhelming. Remember why you chose this noble profession, why your work matters. You being here today is a testimony of your desire to invest in your growth, your compassion, your professionalism, the extra moments you take when no one else sees. India's cancer patients need you. Skilled, compassionate, current in your practice, confident in your abilities. This nursing educational program is designed to help you become just that. You are not just participants in a workshop, you are the future of cancer care in India. You are hope with a stethoscope. You are healing hands guided by science and compassion. Go forth and make today's learning count. Your patients are waiting for you. Thank you, and may this program be enriching, inspiring, and transformative for everyone. All the best, and God bless you all.
Thank you, ma'am. You are to invite Dr. Muhammad Ismail Hejamadi, Chairman, Kanachur Health Sciences Advisory Council, to address our gathering.
Honorable Chairman, Dr. U.K. Monu, sir, and all the dignitaries on the dais, particularly three Saldanas who are present on the dais, and Dr. Smita Saldana. Wonderful job she has done by really giving a beautiful discourse of what cancer is. And she is doing a yeoman's job, being in a government hospital, doing a fantastic job of bone marrow transplantation. And we are proud of you, and you are going to bring a lot of names to Mangalore. And you know very well, Smita is from Falnir, and our guru is after the Neer. That means he is going in the water, swimming, riding, running, and so on. These are the youngsters who are inspiring us. I always tell Guru, I want to come behind you. You keep running, I'll come my in car. So this is what I say, and really fantastic things it's happening here. So as you all know, cancer, you know, the moment you tell cancer, people were scared. When I started my practice, we could not tell cancer to the patient at all. We had to tell to the fourth party, then the third party, then finally the patient dies without knowing what he had. And because at that time we didn't have much medicine anyway. But over the period of years, things have completely changed. There is a paradigm shift in the treatment of cancer. And there is a treatment which now, of course, may be costing, but in future it may become very, very economical. For example, CAR T cell therapy, immunotherapy, gene therapy, and so on and so forth. And one of my friends is there who wants to bring a CAR T cell therapy in Hyderabad. Now I think it must be costing some 5 crores or whatever, I don't know. He wants to bring it for 40 lakh rupees in Hyderabad. He is already discussing with the Israeli people, and I think in the near future he is going to get a CAR T cell therapy. He himself is a owner of a pharmaceutical company. So whatever said and done, the most important thing is that we have 2 events in the world for the cancer awareness. One is by the International World Awareness Day, which falls on February 4th. And another one is yesterday, that is Indian Cancer Awareness Day. Now why is this made? Because we have to be aware of the cancer. Why should we be aware of the cancer? Because the earlier you detect, any cancer can be cured. There is nothing that you cannot cure. The moment the cancer affects the body, it should not defeat the mind. So we have to be very, very positive. And in fact, the positivity brings more immunity. In fact, we have one very big man from Mangalore who is a doctor himself and who is also in the healthcare sector. He has already got ischemic heart disease, and he has got a pacemaker, he has got a renal failure, he has got diabetes, he has got everything, but then he had also so-called fourth stage cancer, and he is completely cured with the immunotherapy. The most beautiful thing he actually, cured, I feel, because I am his personal doctor for many, many years, is his positivity. He always thought he is not going to die soon. He always thought he will be all right with all the disease. So, what I am trying to tell you is that we have to give a positivity to the patient, and we have to, the so-called cancer awareness program is now called a United by Unique. United by Unique. Here, every patient is unique, every doctor is unique, and all the caregivers, the health care workers, including the nursing students and the nurses, are very, very unique. So, with this kind of uniqueness, we can come over and we can really get a victory over cancer, because in India, it is got the world's highest mortality to incidence rate in the world. That is, if you diagnose cancer, highest number of mortality is in India compared to any other countries. Of course, as Dr. Smith has already told, villagers may not come early, we may not detect, and also we doctors may not be knowing what is exactly happening. If buccal ulcer, we may say it is nothing but biting of the tongue and of the teeth bite and so on and so forth. So we may miss. So all of us together should see that we diagnose cancer very early, and cure can be given if you really detect early. Thank you so much. I wish you all the best for today's workshop on cancer detection, evaluation, and treatment. Thank you so much.
Thank you, sir. Not because of their power, but because of their ability to empower others. And true to this, we have a leader who knows the way, goes the way, and shows the way. It's my privilege to request Dr. Haji Monu UK sir, Chairman, Kanachur Islamic Education Trust, to address the gathering.
Assalamu alaikum. Ellarigu namaskara. State level workshop Oncology ಇದರ ಇವತ್ತಿನ ಈ ಒಂದು ವರ್ಕ್ಶಾಪ್ನ ಮುಖ್ಯಸ್ಥರು ಕಾರಲ್ ಸಾಲ್ಡಾನಾ, ನಮ್ಮ ಜಿಲ್ಲೆಯವರೇ, ನಮ್ಮ ಸಿಟಿಯವರೇ, ಮತ್ತು ವೇದಿಕೆ ಮೇಲೆ ಇರತಕ್ಕಂಥ ಎಲ್ಲ ನಮ್ಮ ಹಿರಿಯ ವೈದ್ಯರುಗಳು, ಇಸ್ಮಾಯಿಲ್, ವೆಂಕಟರಾಯ ಪ್ರಭು, ಇತರ ಎಲ್ಲ ಡಾಕ್ಟರ್ಗಳಿಗೂ ಈ ದಿನದ ಶುಭವನ್ನು ಹಾರೈಸ್ತಾ, ಆಂಕಾಲಜಿ ಬಗ್ಗೆ, ಕ್ಯಾನ್ಸರ್ನ ಬಗ್ಗೆ ಒಂದು 2 ಘಟನೆ ನನಗೆ, ಒಂದು ನನ್ನ ಕುಟುಂಬದಲ್ಲಿ ಒಬ್ಬರು ತುತ್ತಾಗಿ ಮರಣ ಹೊಂದಿದರು, ಇನ್ನೊಬ್ಬರು ನಮ್ಮ ಕಾಲೇಜಿಗೆ ಸಂಬಂಧಪಟ್ಟು ಭಾರಿ ಆಸೆ ಆಕಾಂಕ್ಷೆಗಳಿಂದ ನಿಟ್ಟೆಯಲ್ಲಿ ಡೀನ್ ಆಗಿದ್ದರು. ನಿಟ್ಟೆ ಯೂನಿವರ್ಸಿಟಿಯಲ್ಲಿ ಅಲ್ಲಿ ರಿಟೈರ್ಡ್ ಆದ ತಕ್ಷಣ 65ನೇ ವರ್ಷಕ್ಕೆ ನಾವು ರಿಕ್ವೆಸ್ಟ್ ಮಾಡಿ ಅವ್ರನ್ನ ಕರ್ಕೊಂಡು ಬಂದೆವು ನಮ್ಮ ಸಂಸ್ಥೆಗೆ, ಒತ್ತಾಯದ ಮೇರೆಗೆ. ಇಲ್ಲ, ನಾನು ಬರುವುದಿಲ್ಲ, ನಾನು ಇಲ್ಲಿ ಡೀನ್ ಆಗಿ ರಿಟೈರ್ಡ್ ಆಗಿದ್ದೀನಿ, ಇನ್ನು ನಿಮ್ಮಲ್ಲಿ ಬಂದು ನಾನು ಏನು ವ್ಯವಸ್ಥೆ, ಏನು ಪೊಸಿಷನ್ ಹೊಂದಲಿ ಅಂತ ಹೇಳಿದರು. ನಾನು ಹೇಳಿದೆ, ನೀವು ಏನು ಪೊಸಿಷನ್ ಬೇಕಾದರೂ ಕೇಳಿ, ಅಥವಾ ನಿಮಗೆ ಪೊಸಿಷನೇ ಇಲ್ಲದೇ ಇರಲಿ, ನೀವು ನಮ್ಮ ಸಂಸ್ಥೆಗೆ ಬರಬೇಕು ಅಂತ ಹೇಳಿದ್ದಕ್ಕೆ ಬಂದರು. ಮೊದಲನೇ ವರ್ಷ MBBS ಕೋರ್ಸ್ ಸ್ಟಾರ್ಟ್ ಮಾಡಿ ಅವರು ಯಾವ ಥರದ ಸೇವೆಯನ್ನು ಸಲ್ಲಿಸಿದರು ಅಂತ ಹೇಳಿದರೆ, ಅನಾಟಮಿ, ಇವತ್ತು ನೀವು ಕಾಣ್ತಾ ಇರುವ ಕಣಚೂರಿನ ಅನಾಟಮಿ ಮ್ಯೂಸಿಯಂ ಅವರು ಮಾಡಿದ್ದು, ಅವರ ಸ್ವಂತ ಕೈಯಲ್ಲಿ ಅವರೇ ಮೆಟೀರಿಯಲ್ನ ತರಿಸಿ ಕಟ್ ಮಾಡಿ ಆ ಒಂದು ಇದನ್ನು ಅವರೇ ಮಾಡಿದ್ದಾರೆ. ಅವರೇನು ಇಂಜಿನಿಯರಲ್ಲ, ಡಾಕ್ಟ್ರು. ಅದನ್ನು ಇವತ್ತು ನಮ್ಮ ನರ್ಸಿಂಗ್ ಸ್ಟೂಡೆಂಟ್ಗಳು, ನಮ್ಮ ಸಂಸ್ಥೆಯವರಾಗಲಿ ಯಾರಾಗಲಿ ಅದನ್ನು ನೋಡಲೇಬೇಕಾದಂಥದ್ದು. ಅವರು ನನಗೆ ಹೇಳಿದರು, ನಾನು ಇದೊಂದು ಮಾಡಬೇಕು ಅಂತ ಇದ್ದೀನಿ, ನಮ್ಮ ಜಿಲ್ಲೆಯಲ್ಲಿ ಎಲ್ಲೂ ಕೂಡ, ಮಣಿಪಾಲದಲ್ಲಿ ಕೂಡ ಅವರೇ ಮಾಡಿದ್ದು ಅಂತ ಏನೋ ಹೇಳ್ತಾ ಇದ್ರಪ್ಪ, ಮಾಡಿದ್ದ ಅಥವಾ ಅದನ್ನು ಇದು ಮಾಡಿದ್ದು ಏನೋ. ಆದರೆ ಇಲ್ಲಿ ನಾನು ಅತ್ಯುತ್ತಮವಾಗಿ ನಾನು ಮಾಡಬೇಕು ಅಂತ ಇದ್ದೀನಿ, ನೀವು ನನಗೆ ಫುಲ್ ಹ್ಯಾಂಡ್ ಕೊಡಬೇಕು, ನೀವು ಏನು ಬೇಕಾದರೂ ಮಾಡಿ ನಿಮಗೆ ತಿಳಿದ ಮಟ್ಟಿಗೆ ಅಂಥೇಳಿ ಅವರಿಗೆ ಒಂದಷ್ಟು ಬೇಕಾದಷ್ಟು ಹಣ ಮತ್ತು ಅವರಿಗೆ ಮಾಡುವ ಅಧಿಕಾರವನ್ನು ನಾನು ಹೇಳಿದೆ, ನೀವು ಏನು ಬೇಕಾದರೂ ಮಾಡಿ, ಅದು ಅಚ್ಚುಕಟ್ಟಾಗಿ ಮಾಡಿ ಅಂತ. ಹಾಗೆ ಮಾಡಿದ್ದಾರೆ ಅವರು. ಕೊನೆಯದಾಗಿ ಏನೇ ಹೆಲ್ತ್ ಕೇರ್ ಅಥವಾ ಈ ನಿಮ್ಮ ಔಷಧಿ ತಿಂದು ಕುಡಿದು ಅವರನ್ನು ಉಳಿಸ್ಕೊಳ್ಳಿಕ್ಕೆ ಭಾರತದ ಅಥವಾ ಪ್ರಪಂಚದ ಯಾವುದೇ ಟೆಕ್ನಾಲಜಿ ಅಥವಾ ಯಾವುದೇ ಔಷಧಿಗೆ ಸಾಧ್ಯ ಆಗಲಿಲ್ಲ ಅವರನ್ನು ಉಳಿಸೋದಕ್ಕೆ. ಅವರು ಮರಣ ಹೊಂದಿದರು. ಅದು ನನ್ನ ಮನಸ್ಸಿನಲ್ಲಿ ಯಾವತ್ತೂ ಕೂಡ ಈ ಕ್ಯಾನ್ಸರ್ನ ಬಗ್ಗೆ ಯಾರಾದರೂ ಮಾತಾಡುವಾಗ ಅವ್ರು ನೆನಪಾಗ್ತದೆ ನನಗೆ. ಇನ್ನೊಬ್ಬರು ನನ್ನ ಅಕ್ಕನ ಗಂಡ ಕ್ಯಾನ್ಸರಿಗೆ ತುತ್ತಾಗಿ ಎಲ್ಲಿವರೆಗೆ ಅಂತ ಹೇಳಿದರು, ಮಲಗಿದಲ್ಲಿ ಒಂದು ದಿವಸ ನಾನು ನೋಡ್ತೀನಿ, ಈ ಬಾಯಿ ಹಲ್ಲು ಹೀಗೆ ಬಿಟ್ಟರೆ ಬಾಯಲ್ಲಿ ತುಂಬ ಹುಳಗಳು ಇಷ್ಟಿಷ್ಟು ಉದ್ದ. ಅದನ್ನು ನೋಡಿ ನಾನೇ ಪ್ರಾರ್ಥನೆ ಮಾಡಿದ್ದೆ, ದೇವರೇ ಅವರ ಅಂತ್ಯವನ್ನು ಹಾಡಿಬಿಡಲಿ, ಇದನ್ನು ಯಾರಿಗೂ ಕಾಣುವುದು ಬೇಡ ಅಂತೇಳಿ. ಯಾಕೆ ಇದನ್ನು ನಿಮಗೆ ಹೇಳ್ತಾ ಇದ್ದೇನೆ ಅಂತ ಹೇಳಿದರೆ, ನೀವು ನರ್ಸ್ಗಳು ಅಥವಾ ನರ್ಸಿಂಗ್ ಪ್ರೊಫೆಷನ್ನಲ್ಲಿ ಮುಂದುವರಿಯುವವರು, ಯುವ ಪೀಳಿಗೆಗಳು, ನಿಮಗೆ ಇದರ ಬಗ್ಗೆ ಗೊತ್ತಿರಬೇಕು, ತಿಳ್ಕೊಳ್ಬೇಕು. ಅದಕ್ಕೆ ತಕ್ಕಂತೆ ನಿಮಗೆ 2 ಜನ ನಮ್ಮಲ್ಲಿ ಇರುವಂಥ ಇವರು ಡಾಕ್ಟರ್ ಗುರುಪ್ರಸಾದ್ ಅವರು ಮತ್ತು ಸಲ್ಡಾನಾ ಅವರು ನಿಮಗೆ ಅತ್ಯುತ್ತಮವಾಗಿ ಇದರ ಬಗ್ಗೆ ಇವತ್ತು ಹೇಳ್ಕೊಡ್ತಾರೆ. ಇದನ್ನು ಏರ್ಪಡಿಸಿದ್ದಕ್ಕೆ ನಮ್ಮ ಮೌಲಿ ಸಲ್ಡಾನಾ ನರ್ಸಿಂಗ್ ಸೂಪರ್ಡೆಂಟ್ ಅವರಿಗೂ ಧನ್ಯವಾದವನ್ನು ತಿಳಿಸಿ, ನೀವೆಲ್ಲ ಉತ್ತಮವಾಗಿ ಕಲಿತ್ಕೊಳ್ಳಿ. ಮುಂದಿನ ದಿನಗಳಲ್ಲಿ ಇದರ ಬಗ್ಗೆ ಕ್ಯಾನ್ಸರಿಗೆ ಯಾವತ್ತೂ ಕೂಡ ಅದನ್ನು ನೀವು ಮುಂದೂಡ್ಬೋದು, 1 ತಿಂಗಳು ಅಥವಾ 6 ತಿಂಗಳು ಅಥವಾ 1 ವರ್ಷ 2 ವರ್ಷ ಮುಂದೂಡ್ಬೋದೇ ವಿನ ಅದರಿಂದ ನಾನು ಬಚಾವಾದ ಬದುಕಿಸಲಿಕ್ಕೆ ನನ್ನ ಅಂದಾಜು ಇದರಲ್ಲಿ ಸಾಧ್ಯ ಇಲ್ಲ ಅಂತ ಕಾಣ್ತದೆ ಈ ಡಾಕ್ಟ್ರುಗಳ ಸಮೂಹಕ್ಕೆ. ಅದು ಏನೇ ಆಗಲಿ ಅವರು ಬದುಕುವ ಕಾಲದಷ್ಟು ಅವರಿಗೆ ಅತ್ಯುತ್ತಮವಾಗಿ ಅವರನ್ನು ಸಂತೈಸಿ ಅವರಿಗೆ ಸೇವೆ ಕೊಡುವ ಜವಾಬ್ದಾರಿ ಡಾಕ್ಟ್ರುಗಳು ಎಷ್ಟೇ ನಿಮಗೆ ಹೇಳಿದರೂ ಅದನ್ನು ಮಾಡುವವರು ನೀವು. ಅದಕ್ಕೆ ನೀವು ತಯಾರಾಗಿ ಉತ್ತಮವಾಗಿ ಅವರು ಹೇಳುವುದನ್ನು ಆಲಿಸ್ಕೊಂಡು ಕಲಿತು ಮುಂದುವರಿಯಿರಿ ಅಂತೇಳಿ ನನ್ನ ಮಾತನ್ನು ಮುಗಿಸ್ತೇನೆ. ಜೈ ಹಿಂದ್.
Your words of inspiration. We are honored by the gracious presence of our esteemed chief guest, Dr. Smita Carol Saldana, MBBS MDS, Kidwai Memorial Institute of Oncology, Bangalore. Thank you, ma'am. We sincerely appreciate your presence today. May I request Dr. Haji Moni UK Sir, Honorable Chairman, Kanachur Islamic Education Trust, to hand over the token of gratitude to our chief guest. Honored by the gracious presence of our today's resource person, Dr. Guru Prasad Bhatt, Medical Oncology, Kanachur Hospital and Research Center. Thank you, sir. We sincerely appreciate your presence today. May I request Dr. Haji Moni UK Sir, Honorable Chairman, Kanachur Islamic Education Trust, to hand over the token of gratitude to our chief guest. Thank you, sir, and thank you, ma'am. Let us to be grateful to the people who makes us happy. They are the charming gardeners who make our soul blossom. I call upon Professor Sherin Joseph, Vice Principal, Kanachur College of Nursing Sciences, to deliver the vote of thanks.
Gratitude is a bridge that turns moment into memories. Good morning to all gathered here. I consider it a profound privilege to extend a vote of thanks on this day. I would like to begin by giving thanks to the Almighty God for His infinite grace and blessing make this occasion to happen. I extend my deepest thanks to our most respected Dr. Haji UK Monu Sir, Chairman, Kanachur Islamic Education Trust. Your vision and dedication to advancing our institution goal have been a guiding light for us. Your support in championing initiative like this has created a platform for learning, collaboration and growth. Thank you, sir. We are deeply grateful to our chief guest, Dr. Smita Carol Saldana, Senior Consultant in Medical Oncology, Kidwai Memorial Institute of Oncology, Bangalore. Madam, your insightful words, profound wisdom, and gracious presence have truly enriched our gathering. We sincerely appreciate the time and effort you have devoted to share your valuable knowledge and experience with us. We are also delighted that you will be conducting yet another enlightening session for us, and we are look forward to gain further inspiration and learning from you. Thank you, madam. I also express my heartfelt thanks to Mr. Abdul Rahman Sir, Director Kanachur Institute of Medical Sciences, for his endless support in all our endeavors. I thank him in his absence. I take this immense pleasure in extending my sincere thanks to Dr. Muhammad Ismail Hejmadi, Chairman, Kanachur Health Science Advisory Council. We greatly value the support and advices you have given us throughout this journey. I devote my sincere gratitude to Dr. M. Venkatrai Prabhu, Member, Kanachur Health Science Advisory Council, for his constant motivation. We are truly thankful to Dr. Guru Prasad Bhatt, Chief Medical Oncologist, Kanachur Hospital and Research Center. Sir, your constant guidance and support right from the planning stage have meant so much to us. Your session were truly inspiring, filled with knowledge, energy and positivity. You are not only an excellent oncologist, but also a wonderful human being, humble, passionate and full of life. Your love for nature, your athletic spirit, and your achievement as an Ironman award winner remind us what dedication and balance really mean. We are deeply grateful for the time, effort, and inspiration you have shared with us. Thank you, sir. Bringing an event of this magnitude to life take considerable time and effort. I would like to extend my gratitude to the guiding hand behind it all, our beloved principal, Dr. Professor Moli Saldana. Thank you, madam, for your unwavering support and guidance throughout the planning and execution of this event. I take this opportunity to thank Dr. Anjan Kumar, Medical Superintendent, Kanachur Hospital and Research Center. I would like to acknowledge and thank Dr. Rohan Monis, Chief Administrative Medical Officer, Kanachur Hospital and Research Center, for his enormous cooperation and encouragement. My sincere thanks to Principal, Kanachur Ayurvedic Medical College, Dr. Vidya Prabha, for her gracious presence, and I owe my sincere gratitude to Dr. Suresh Nagalagudi sir, Medical Advisor, Kanachur Ayurveda Medical College, and I also extend my grateful thanks to Miss Irene Saldana and Mrs. Josie Paul of our hospital. They are the nursing superintendent and deputy nursing superintendent. Thank you, madam, for your valuable presence. It is my pleasure to thank all heads and faculty of various departments for accepting our invitation and gracing this occasion. I would like to acknowledge the hard work and dedication of the organizing secretary, Professor Ann Barnes, and joining secretary, Mrs. Divya. Your meticulous planning and execution have played a significant role in smooth running of this workshop. I want to take a moment to extend my heartfelt gratitude to my colleagues for the outstanding job you did in organizing this workshop. Your hard work and dedication, collaborative spirit were truly remarkable. A word of appreciation to Mrs. Akshita, Master of Ceremony of this workshop. Your effort added great value to this event. A special note of gratitude to the non-teaching staff of our college for their valuable contribution. I extend my heartfelt thanks to the press and media for their extensive coverage of this workshop. I also like to express my sincere gratitude to IT in charge, Mr. Avinash and his team, for their technical support, Mr. Anjuman for the flex arrangement, Mr. Siddiq for the delicious food, and the housekeeping department for the dedication assistance throughout this program. A special thanks to all the delegates who have joined from various institutions, staff nurses from the Kanachur Hospital and Research Center, and our students. Your presence are really added great value to this workshop. We sincerely thank each one of you for choosing to be part of this program. Though the workshop has just begun, your enthusiasm and commitment assure us that it will be an enriching and memorable experience for everyone. Wishing you all meaningful and enjoyable learning session ahead. I extend my deepest thanks to the volunteers of 4th year BSc Nursing who worked diligently behind the scene to ensure the smooth execution of the ceremony. Once again, I thank you all. Have a great day. Thank you.
Thank you, ma'am. As we conclude ceremony, let us raise for the national anthem.
जनगण मन अधिनायक जय हे भारत भाग्य विधाता पंजाब सिंधु गुजरात मराठा द्राविड उत्कल वंगा विंध्य हिमाचल यमुना गंगा उच्चल जलधि तरंगा तव शुभ नामे जागे तव शुभ आशीष माहे गाहे तव जय गाता जनगण मंगलदायक जय हे भारत भाग्य विधाता जय हे जय हे जय हे जय 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 हे।